for our colleagues to get over, our CTV colleagues. Sorry, could you give us your name, please?
It's Dr. Andrew Falconer, F-A-L-C-O-N-E-R.
F-A-L-C-O-N-E-R. And what is your title?
I'm Chief of Staff.
Chief of Staff. Are you part of the treatment team for these?
Today I'm the administrator, mobilizing our resources internally.
Okay. So what can you tell us about the people that came to your hospital?
So at this point in time we've received 4 patients from the collision, all of whom are stable, 2 of whom will need orthopedic surgery.
So what kind of injuries did they sustain?
Broken bones.
Could you give us
and
more
minor
details?
head injuries and cuts. Some of the broken bones are serious enough to require surgery. Others will just require casting.
So why would they come to your hospital, not to the other one? Are you the closest one? Or?
We're the closest hospital, and dispatch will try to triage patients according to the severity of their injury. So the major head injuries or multi-system traumas will go to our trauma center, which is the civic site of the Ottawa Hospital. We receive the less severe casualties here.
So could you tell us sort of when you first heard about this and sort of how the day unfolded?
So I first heard about this at around 8:30 on the news, actually, when I was coming back from a meeting at the Ottawa Hospital. We had already mobilized our resources internally, and we've had many surgeons and much of our staff in the emergency department not knowing what to expect initially. At this point we can certainly handle everything that we've got.
So when did they arrive here?
They started arriving around 9 o'clock this morning.
And tell us about what they were going through at that time.
Certainly the injuries are very painful, and people are very frightened, understandably. So a lot of emotional trauma and some physical trauma.
Were they all off the bus?
My understanding is they're all off the bus, yes.
Can you tell us about the age range or gender of these patients?
We have 3 males and 1 female, ranging in age from about 30 to 80.
So you have 4 patients now. When did the 4th one arrive?
Just now.
And has that person been triaged at this point?
Yes, patient's triaged. So we've already received all of the major injuries. So they're triaged first by the paramedics at the scene. So all of the major trauma have already been received by the hospitals. We'll now be receiving those that had less severe injuries. And we don't know how many of those there'll be at this point. So we're on standby, ready to accept whatever we get.
How many staff have been called in to deal with it?
So we had 8 emergency physicians. We would normally have between 2 and 3, and we have 3 orthopedic surgeons. We'd normally have 1 and 2 general surgeons.
So have you called more people in to deal with this?
Yes, yeah. Again, not sure what to expect. We did have our ORs, our operating rooms, on standby, but we are proceeding with all of our elective surgical volume today. But if there was a need to cancel surgery, we would have done that. As it is, we can accommodate what we've got so far.
Sorry, you described the injuries before. I mean, it sounds to me like they're sort of lower limb injuries, or could you be more specific?
Most of them are, lower limb fractures or breaks in bones. There are some cuts, and there are some head injuries also, some bruises to head, but mostly leg fractures.
And that would come from what? The impact? Or what?
The impact, yeah, the blunt trauma.
Do you know what part of the bus they were on?
No, I don't have that information.
So you could be getting more people throughout the day?
Yes, we expect we will be.
Could you describe your hospital? Now, it's not a sort of a big emergency hospital. How would you describe this hospital versus the other ones in Ottawa?
So our major trauma center is the Ottawa Hospital Civic Campus, and they have the ability to deal with brain trauma, with blood vessel injury, and it's the only center in Ottawa that has that. We have all the other surgical services here, so general surgery, orthopedics. We have everything except neurosurgery, thoracic surgery, and vascular surgery here. So the patients that would require the tertiary services of the Ottawa Hospital will be triaged there, and then patients that are unlikely to need that would be triaged here.
So the people that you have now, the 4 patients you have now, are they have they been treated and are through surgery, or what's the state now?
They're still being worked up, and they'll be operated on this afternoon.
So when you say worked up, what is that?
We're doing x-rays, blood tests, making sure that there's no missed injuries. Sometimes there can be more than one injury that a patient suffers, so we're trying to make sure we have a full understanding with our diagnostic workups.
So I'm sure you've been through a number of things in your career as a doctor, but how would you compare this to what you've seen in other years in the past?
This is definitely one of the worst events that we've seen in the city or at this hospital. The tragic loss of life and injury to people. It's overwhelming to imagine the suffering that's going on. We have had other mass casualties in the past, not for many years, and this one is definitely tragic.
The 4 people you have, would you describe their injuries not as life-threatening?
They're not life-threatening injuries, no.
Do you know where these patients are from? The train was coming from Montreal. Do you have any sense of what home is for them?
No, I don't know that.
Do you know if their families have been contacted?
The families are here, actually. So the families are contacted and are here and are speaking with their loved ones at this point. We have staff trying to help the families also. Again, you can imagine the tragedy and the emotional trauma that people experience at this time. So we have social workers and support staff with the families at this point also. And we're doing our best to keep the families well informed as to what stage in the diagnostic workup their loved ones are and when they'll be going to the operating room if that's what's required.
So of the 4, how many require surgery?
At this point, 2 that we know for certainty.
What kind of fractures you said? Was it leg?
They're leg fractures.
Mainly?
Yeah, all.
No,
There, I think there was one wrist fracture also, but mostly leg fractures.
so no ribcage fracture.
Nothing like that so far.
And do you know where they were sitting on the bus?
I don't know that. No.
Have they talked to you at all about what happened? Have they said any indication of whether they saw this coming?
No, I don't. I don't know any of that. I've been trying to deal with getting them into the medical treatment that they need. So I have not personally spoken with any of the patients.
How many